The last 10 years have seen a worldwide expansion in all sectors of the poultry industry. This is true both for the various specialized aspects of poultry husbandry and also for the rapid growth in, for example, turkey and duck growing. This expansion can also be seen in third world countries. Much work has been done and continues to be done on new technological insights and new techniques to improve and optimize poultry management. The health care of poultry plays an essential role in this. The steadily increasing concentration of a number of birds kept under one roof and under the same conditions has led to a continually growing specialism in the field of health care. Furthermore, diseases have changed, and new diseases have developed under these conditions. This has led to the need for new and improved vaccines, such as those developed by Intervet. Since the beginning of the 80s, when we put together the first edition of this program, the prevention of diseases has become of even greater importance. Vaccination schemes against the most prevalent poultry diseases have therefore become a subject of general concern. Without these possibilities, the poultry industry cannot continue to exist under present conditions. This program presents an up-to-date review of the most important vaccination techniques. Although our research programs will always continue, we already have at our disposal an extensive range of viral and bacterial vaccines. These vaccines can be divided into two basic groups. Live vaccines, which can be administered using various techniques, and inactivated or killed vaccines, which can only be administered by injection. Both the choice from the different types of vaccines and the choice of a particular vaccination technique will depend on a number of factors. These factors will be considered during the following discussion of techniques and vaccines. First, the inactivated vaccines. For many years, there has been a growing trend in the poultry industry to use inactivated vaccines. This is a logical development, since some diseases can only be adequately controlled using these vaccines. The most important advantages of inactivated vaccines are long-lasting, optimal, and uniform immunity is produced. An inactivated vaccine produces a minimal amount of systemic stress. Fewer revaccinations are needed using inactivated vaccines. There is no danger of spreading vaccine viruses or bacteria. The full range of inactivated poultry vaccines developed and produced by Intervet covers an extremely wide field. The last few years have seen the addition of a series of new vaccines as well as a number of combined vaccines. In 1985, Intervet was the first veterinary pharmaceutical manufacturer to succeed in producing a four-way inactivated vaccine, specially designed for breeders. The vaccine Nobivac, Rio IB Gumbro, and ND, also known as BreederVac 4 in the USA. Most inactivated vaccines, both the single and combined forms, are usually administered during the rearing period of breeding stock and commercial egg producers. Some inactivated vaccines, such as the inactivated ND vaccines Nucavac and Nobivac ND broiler, can also be given to broilers. As can be seen here, inactivated vaccines must be injected. There are two techniques. Intramuscularly, in the breast or the leg, and in some cases, into the wing. For injection into the breast, the needle is inserted into the muscle, parallel to the breastbone. During injection into the leg, care must be taken to avoid damage to the joint. Subcutaneous injections are usually administered in the neck. Day-old chicks are vaccinated subcutaneously in the neck or intramuscularly in the leg. Automatic vaccinators can be used for these day-old vaccinations, as is usually the case with Merrick vaccinations. Whatever technique is used, the following precautions should be taken during vaccination with inactivated vaccines. The vaccines must be kept cool and stored at a temperature of between 4 and 8 degrees Celsius. It is desirable to allow vaccines to reach room temperature before injection. Use only clean, sterile syringes with the correct needle, syringes that can be accurately calibrated. Shake the vials well before use. It is vitally important that all birds are vaccinated with the correct dose of vaccine. Despite the speed of the operation, the injection must always be accurately carried out. Make sure that the needle does not slide along the skin between the feathers. The needles should preferably be of the type 10 by 1 to 1.5 millimeters, and they should regularly be replaced. We advise a new needle for every 100 birds. As well as being used in chickens, certain inactivated vaccines can also be used for vaccinating turkeys and pigeons. Turkeys are usually vaccinated subcutaneously in the neck, as is demonstrated here. Pigeons can be vaccinated against paramyxo virus disease using the inactivated vaccine Nobivac paramyxo, which was specially prepared for pigeons. The injection must be given subcutaneously in the lower half of the neck. The needle used should be 16 to 20 by 1 millimeter. Most live poultry vaccines can be applied by mass vaccination. Individual application using live vaccines, however, is also possible. The technique used can or should depend on various factors, such as the kind of vaccine, the type of bird and its age, and to a lesser extent, the husbandry and management. Live vaccines can be administered by various methods. By injection, ocular or nasal vaccination, the Becovac method, spray vaccination, drinking water vaccination, and finally, 3 techniques that can be considered together: wing web and follicle administration, and oral vaccination. Injection of live vaccines is used in vaccination against such diseases as Marek's disease. When diluting the vaccine, only use the sterile diluent supplied. Before use, check that this diluent is clear. There must be no sediment present, and cloudiness could indicate contamination with bacteria or fungi. Dissolving the vaccine must, of course, take place under aseptical conditions. It is important to use the diluted vaccine as quickly as possible. When it cannot be used immediately, the vaccine must be stored on ice. We showed the dilution of the freeze-dried Marek vaccine. Cell-associated Marek vaccines are stored and transported in liquid nitrogen at a temperature of -196 degrees Celsius. This extremely low temperature requires special precautions during thawing of the vaccine. Rapid transfer from the liquid nitrogen container to room temperature could sometimes lead to explosion of the ampoules. Safety glasses or a safety mask must therefore always be worn during thawing of cell-associated vaccines. Once thawed, the vaccine may not be returned to the liquid nitrogen container. In the hatchery, chicks are usually vaccinated using automatic vaccinators. The vaccine is administered to day-old chicks subcutaneously in the neck or intramuscularly in the leg. It's important that the vaccination of day-old chicks takes place under completely hygienic circumstances, working therefore in very clean areas. Ensure that each chick receives the correct dosage. The vaccine should be shaken frequently but carefully during the vaccination process, and needles should be changed regularly. Never keep leftover vaccines, and ensure that any leftovers are always destroyed. The ocular and nasal vaccination methods are the best techniques for vaccination using live vaccines, since they ensure that each bird receives the correct amount of vaccine. They provide rapid protection. These techniques are, however, rather labor-intensive. Ocular and nasal vaccination methods are used, for example, for vaccination against IB, ND, and ILT. Ocular nasal vaccination is administered as follows. Dissolve the required amount of vaccine in the sterile solvent. This has usually had a dye added to it. This makes it easy to check that every bird has been vaccinated. The solvent is usually supplied in a special dropper, as shown here. One drop of the dissolved vaccine is applied onto the eye or into the nostril of each bird. To prevent damage to the eye, the dropper itself should not be allowed to touch the eyeball. When using the nasal vaccination method, it is advisable to close off one nostril with a finger. This ensures better inhalation of the vaccine droplet. Ocular nasal vaccination can be used for birds of all ages. Vaccination of birds older than 1 day should be done very carefully to avoid creating unnecessary stress. Using ocular nasal vaccination, Every bird must be vaccinated in order to achieve rapid and lasting protection. During vaccination, keep the dropper absolutely vertical. This ensures that the droplet size and the number of doses remain constant. Nowadays, ocular vaccination can also be performed using semi-automatic vaccinators. This is usually a combined apparatus which can be used with several vaccination techniques, as is the case here. This can be used for semi-automatic vaccination using both the ocular and the wing web methods. The Beakovac method allows a quantity of vaccine to be administered into the beak of the chick, whilst at the same time the bird is debeaked. A number of countries, and particularly the United States, have been using this method for some time in their hatcheries. The Beakovac method allows vaccination of chicks against, for example, IB and ND. When mass vaccination is or can be employed, spray vaccination is the method of choice. There is a number of different spray techniques for both day-old chicks and for older birds. We shall deal with these separately. Automatic spray vaccination of day-old chicks in the hatchery. Vaccination of day-old chicks using a hand spray. Spray vaccination of older birds, and aerosol vaccination, a revaccination method for older birds. One should realize, however, that the spray method requires accuracy and experience if the vaccination is to be effective enough to produce lasting immunity without causing excessive vaccination reactions. Furthermore, as with all vaccination, the birds must be healthy if undesirable reactions are to be avoided. Fully automatic spray vaccination is a vaccination technique that is practically confined to hatcheries. With this technique, up to 10,000 chicks per hour can be vaccinated. The most frequently used vaccines for day-old vaccination are the live IB and ND vaccines. The amount of water used for dissolving the vaccine depends on the type of spray equipment. Day-old chicks not vaccinated at the hatchery must be vaccinated immediately upon arrival. This can be performed as follows. The method of choice is an ordinary hand spray with an adjustable spray nozzle, which allows droplet size in the spray to be regulated. Generally speaking, for the vaccination of 1,000 chicks, the vaccine should be dissolved in 200 milliliters of water at about 20 degrees Celsius. The water should be of very good quality, preferably distilled or demineralized. To facilitate dissolving freeze-dried vaccine, the vials should be opened underwater. The sprayer is filled with the diluted vaccine. The equipment should be extremely clean and should certainly be totally free of disinfectant and detergent. The spray is brought up to operating pressure, and then the spray nozzle is adjusted. The droplet size should not be too large. Neither should the size be too fine, since this increases the chance of a severe vaccination reaction. Adjusting the spray nozzle can best be done against a dark background and facing the light, as shown here. This gives a better view of the droplet size. Those lacking adequate experience with this technique are advised to contact Intervet for technical advice. Before spraying, the boxes with the chicks should be put against each other in rows. The boxes to be sprayed should not be placed anywhere near heaters. Do not hold the spray nozzle too high above the chicks during spraying. The recommended height is about 40 centimeters. Spray rapidly enough to dampen the chicks, but not to wet them. The setting of the spray nozzle should be regularly checked during spraying. The chicks should remain in the open boxes for about 10 to 15 minutes after vaccination. Portable agricultural spraying equipment is usually used for the spray vaccination of older birds. These sprayers should be strictly reserved for use in vaccinations. 500 milliliters of very high quality water is needed to spray 1,000 birds. If there are doubts about the quality of the water, it is better to use distilled or demineralized water. Spray vaccination of older birds is usually directed against infectious bronchitis, Newcastle disease, and Gumbarus disease. To be certain that all birds have been vaccinated, the flock should be gently grouped together. Part of the accommodation could perhaps be separated by wire mesh for this purpose. Mechanical ventilation should be turned off during and for a short period of time following vaccination. The light should also be dimmed. Vaccination in open housing should therefore be performed in the evening. We advise covering the nose and mouth with a mask during spraying. In some countries, that is in fact obligatory. Obviously, it's pointless spraying in open houses which are not closed off with curtains and which cannot therefore be made windproof. After vaccination, both the interior and the exterior of the spraying equipment should be thoroughly cleaned, preferably with hot water. We advise against using disinfectants. Should they be used, the equipment must be thoroughly rinsed afterwards. These days, revaccination of older birds can be performed using an aerosol apparatus, or atomist. Since this method spreads a very fine mist or fog, problems can be encountered. In the hands of the inexperienced, aerosol vaccination can lead to serious respiratory reactions. We therefore advise against the use of this technique by those lacking the necessary experience. Should it be used, ensure that the birds are in an optimal state of health. Obviously, a protective mask covering nose and mouth should be worn by anyone employing the aerosol technique. Although vaccination via drinking water would seem to be the least labor-intensive, it is certainly not the simplest method. There are quite a few precautions that need to be taken if the vaccination is to be effective and reliable. Firstly, the quality of the drinking water must be checked. too high or too low a pH can have a negative effect on the efficacy of the vaccine virus. Also, a chloride level that is too high or contamination with, for example, heavy metals may inactivate the vaccine virus. If you are not able to check the quality of the water yourself, then this must certainly be performed beforehand in an experienced laboratory. In some cases, the addition of about 20 grams of skimmed milk powder to 10 liters of water can improve the stability of the vaccine virus. As well as the problems surrounding the quality of the drinking water, there are various problems connected with the extensive range of drinking water installations available. For example, there are some systems which are difficult to drain. We advise, where possible, against using the drinking water technique for vaccinating birds younger than 3 weeks old, since the intake of water before that age is too irregular. Finally, we should point out that IB and ND vaccines cannot be administered via a drinking water system that uses drinking nipple installations. When it is not possible to meet all the demands for completely reliable drinking water vaccination, we advise using another method. The drinking water technique can be used for vaccination against, for example, IB, ND, Gumboro, ILT, and AE. The method is as follows. All drinking troughs and drinkers must first be cleaned, and of course, they must be free of all detergents and disinfectants. For adequate vaccination, it is essential that all birds can drink enough medicated water within 2 to 2.5 hours. To be sure of this, the birds must be starved of water for a period of time prior to vaccination. How much time that requires depends on several factors, such as the type of bird, the age, and the climatic conditions. Open the vaccine vials under water. The amount of water needed to dissolve the vaccine depends principally upon the age of the birds. As a rough guide, for 1,000 birds, 1,000 doses of vaccine should be dissolved in as many liters of water as the age of the birds in days. This holds true for birds from 20 to 40 days old. From 40 days onwards, the maximum amount of water used should be 40 liters. With the vaccination of broilers, it is advisable to double the amount of water and to administer the vaccine solution twice, one after the other. This is because of the large water intake of broilers. Furthermore, it is difficult to dissolve the vaccine satisfactorily in large quantities of water. As the last point in this series, we would like briefly to cover 3 remaining vaccination techniques. These are wing web vaccination, follicle vaccination, and oral vaccination. The wing web method is the preferred vaccination technique for prevention of fowl pox. This vaccination can also be administered with the combined AE fowlpox vaccine Nobilis. The vaccine is dissolved in the diluent using the special adapter provided. The wing web method can be used in birds of all ages. The vaccination needle is entirely immersed in the vaccine solution and then stuck into the wing web as demonstrated here. When vaccinating birds younger than 2 weeks old, it is advisable to remove one of the 2 needles. As was shown when discussing ocular vaccination, the wing web vaccination technique can also be performed using semi-automatic vaccinators. Follicle vaccination is not usually performed in chickens anymore, but is advised for the vaccination of pigeons against fowlpox. As in the wing web method, the vaccine is dissolved in the diluent using the adapter provided. To vaccinate using this technique, about 15 feathers should be carefully removed from the thigh or the breast, taking care that no bleeding occurs. These follicles are then rubbed with the vaccine using the vaccination brush supplied. The individual oral method is now practically limited to the vaccination of 8 to 16-week-old chicks against AE, or epidemic tremor. In this technique, it is usual to vaccinate about 5% of a flock of birds. The vaccine virus will then be transmitted adequately through the rest of the flock via the vaccinated birds. One requirement is, of course, that the birds are housed so as to have adequate contact with each other. The 5% oral AE vaccination technique cannot therefore be used for caged birds. This method should also not be carried out when the birds are maintained on complete wire mesh floors. Finally, we would like to make a few general recommendations which apply to all vaccination techniques. It is essential that only healthy birds are vaccinated. Always use the correct diluent. Make sure that the vaccine is stored according to the manufacturer's instructions. Check the expiry date. Always work with sterile syringes and needles and clean incidental materials and equipment. Always thoroughly clean materials directly after use. All disposable materials, vials, and stoppers should be disinfected before being discarded. Chick boxes and other packaging material used during day-old vaccination should be disinfected or burned. Always wash your hands thoroughly with detergent or disinfectant, and carefully disinfect the work clothes you were wearing. Register the vaccinations performed on the vaccination record cards or in the company computer. Always note the batch number of vaccines used. This brings us to the end of the program, Poultry Vaccination Techniques. An information program, such as the one you have just seen, however detailed it may be, can never be truly complete. Too many factors influence the choice of types of vaccines and the vaccination technique to be applied. We would therefore like to invite you to discuss your particular problems and questions with one of our technical advisors, so that we can help you and your company to develop and maintain the healthiest and most productive poultry.